From Asylum to Modern Hospital, Dr. Mohamed Talaat Reda, founder of Psychiatry in Kuwait. This is the story of a man whose vision reshaped a nation. Dr. Mohamed Talaat Reda, founder, visionary, and humanitarian, laid the foundations of modern mental health care in Kuwait, not through buildings alone, but through dignity, science, and compassion. His work and achievements went beyond a role, transcending a mere paid position. This legacy was more than achievement, it was a deeply human story, a story of courage, reform, and unwavering belief that mental illness deserves understanding, not fear, and treatment, not confinement. Dr. Talat pioneered modern, compassionate, stigma-free psychiatric care in Kuwait, transforming countless lives. Yet every pioneer begins somewhere, and his journey began in Cairo. In 1946, he graduated from Cairo University with a medical degree during a pivotal era in Middle Eastern medicine. In just 2 years later, in 1948, he completed a specialization in nervous and mental diseases, a field where diagnosis relied on clinical experience and the patient's narrative of distress, rather than laboratory tests or imaging. But education alone does not create a reformer. Experience does. Dr. Talat gained crucial experience at Abbasiyah Hospital, one of the region's leading psychiatric institutions. Mentored by leading psychiatrists, he integrated theory with disciplined clinical practice. He was prepared not by knowledge alone, but by a deep sense of purpose and a humanitarian calling. Kuwait's transformation, from oil discovery to export. In 1938, oil was discovered at the Burgan field. Kuwait stood at the edge of change. In 1946, the first exports followed, a dramatic shift from pearl diving, fishing, and shipbuilding to an oil-based economy that ignited comprehensive national development. By the early 1950s, Kuwait was rapidly modernizing. Infrastructure expanded, public health advanced, medical facilities emerged, yet mental health remained neglected, trapped in stigma, fear, and misunderstanding. Psychiatry did not yet exist as a medical discipline in the country until one arrival changed everything. In September 1955, everything changed. Kuwait welcomed its first psychiatrist, Dr. Mohamed Talaat Reda. He joined Kuwait's public health department and commenced service as the country's first psychiatrist. He arrived not to manage an established system, but to build one from nothing. For him, service always preceded privilege. Upon Dr. Talat's arrival, he encountered a system in crisis. Mental illness was not yet recognized as a medical condition, feared and misunderstood, linked to possession, envy, and sorcery. Patients were stigmatized and isolated. They were confined, not treated. Families relied on charlatans and charms to lift the curse, while patients endured brutality to expel the evil. But nowhere was it clearer than in Shark. To understand, we must go there. In Shark stood the Asylum of Lunatics. As described by Dr. Talat in his article, The Development of Mental Illness Treatment, Al Arabi magazine, December 1964. Dark, narrow rooms, barred windows, sandy floors, housed 25 patients. No medical records, no treatment plans, no dignity. What existed was not care. It was confinement. Dr. Talat's response was swift and uncompromising. Iron cages and restraints were removed immediately. Cells became clean, ventilated wards with beds. Dignity and care replaced punishment. Medical records and formal admission procedures were introduced. Medications and electroconvulsive therapy became standard clinical care. Outpatient services and a pharmacy were established. A new floor was constructed. Rehabilitation included a cinema for recreation and social reintegration. Dr. Talat's ambitions went beyond the asylum. He believed that true reform demanded a new hospital. So, he pursued and secured the approval of the Minister of Public Health Department, Sheikh Fahad Al-Salem Al-Sabah, to build a new modern psychiatric hospital, grounded in science and guided by humanity. This vision marked a decisive turning point in Kuwait's mental health care. On December 23, 1958, the vision became reality, and a new era began. Kuwait opened its first specialized psychiatric hospital, the first of its kind in the Gulf region, 4 wards and 91 beds, structured care for the first time. The hospital quickly became more than a building. Outpatient clinics, laboratories, pharmacies, and administration followed, even a cinema hall. Care expanded beyond medicine to dignity and daily life. Dr. Talat built psychiatric capacity through overseas specialization and the recruitment of new psychiatrists. Soon, the hospital drew the attention of international experts. In 1963, Dr. Nathan Klein, a prominent psychiatrist of the United States, visited the hospital to observe the progress of Kuwait's psychiatric care. In his published paper, Psychiatry in Kuwait, he documented patients once chained and caged, many of them left unsupervised. Dr. Klein described the hospital's well-maintained records as a treasure trove for scientific research. But these reports did not initiate reform. They only confirmed a crisis Dr. Talat had already begun to dismantle. By 1964, the hospital had entered an era of rapid growth. 13 new wards were added, expanding capacity from 91 beds in 1958 to 465 beds. Patient well-being became a priority, with therapeutic gardens, modern cinema hall, and dedicated activity zones. Vocational training programs were launched to support rehabilitation and reintegration. The philosophy was clear: treating the person, not just the illness. Modern psychiatric practices were introduced: advanced medications, insulin therapy, ECT under general anesthesia, science-guided care, compassion at the core. However, recovery went beyond medication, it demanded rehabilitation. Skill development: patients learned carpentry and weaving. Therapeutic engagement: farming and gardening therapy offered the patients environmental engagement. Core mission: treatment aimed to restore lives and prepare patients for life beyond the hospital. Rehabilitation restored skills and dignity, but humanizing care demanded freedom. Increased freedom: Dr. Talat's reforms allowed patients greater mobility and freedom within the facility, ending confinement practices. Family involvement: he encouraged regular family visits, strengthening social connections and breaking isolation. Patient choice: Dr. Talat granted patients the right to go home, even against their doctor's advice. Cultural shift: these measures dramatically reduced public stigma and increased perception of mental illness. However, sustaining progress required vision and leadership. Dr. Talat served as the founding director, personally overseeing the hospital's launch and early operations. He provided continuous leadership to the institution for an impressive span of 25 years. His tenure built a system grounded in modern science, genuine compassion, and global psychiatric standards. This model soon spread beyond Kuwait. The hospital's success attracted patients seeking advanced treatment from across the GCC. Kuwait emerged as a regional model, with the hospital widely recognized for its humanitarian standards, cleanliness, comfort, and safety. Its prominence and progressive approach were formally acknowledged through favorable coverage in publications. However, this regional model required global engagement. Dr. Talat collaborated with WHO leaders, including Dr. Tijani El-Mahi and Dr. Taha Bashir, to foster knowledge exchange. He hosted British and European delegations to showcase the hospital's mental health services. A pivotal moment in this era was the 1969 visit by Professor Sir W. H. Trethowan of the University of Birmingham. His endorsement validated the hospital's high standards and firmly aligned Kuwait psychiatry with global benchmarks of excellence. Kuwait was no longer learning alone. It was leading. Dr. Talat represented Kuwait as the first Arab delegate at the World Federation for Mental Health Conference in Zurich, 1957. He represented Kuwait, highlighting its progress at leading international mental health forums. His expertise was sought through active contributions to multiple World Health Organization conferences. Dr. Talat's influence also extended through authorship. Dr. Talat authored Kuwait's first mental health reference, Principles of Nervous and Psychiatric Diseases, in 1975, which was adopted into the core curriculum. He served as an instructor at the Kuwait Nursing Institute, shaping future healthcare workers. He also established psychiatric education, shaping generations of doctors and nurses through knowledge. Dr. Talat tackled one of society's most complex challenges, addiction, by treating it as a medical condition, not a moral failing, and founding Kuwait's first addiction treatment unit within the hospital. Under his leadership, care and rehabilitation replaced punishment and confinement. His integrated model, combining detoxification, psychotherapy, and social rehabilitation, laid the blueprint for Kuwait's modern recovery centers. Dr. Talat's expertise was called upon at the national level. In the early 1980s, he was appointed psychiatric consultant to the Ministry of Health, marking the peak of his influence. During his tenure, he helped shape Kuwait's mental health strategy, mentored future leaders, and kept science and compassion at the heart of care. However, such contributions did not go unrecognized. In 1973, Dr. Talat was awarded the Fellowship in Psychiatry by the Royal College of Psychiatrists, London, UK, and was selected as a founding fellow. In 1975, the state of Kuwait granted him citizenship in recognition of founding the country's first psychiatric hospital, built from the ground up, and for advancing mental health care standards, acknowledging that his work and achievements transcended a mere paid position. In 1984, he was recognized by the Kuwaiti Medical Association. Though his career concluded, his influence did not. In 1986, after more than 30 years of a distinguished career in service to the people of Kuwait, Dr. Talat retired, leaving behind a legacy that endures. He remains recognized as the father and founder of psychiatry and modern mental health in Kuwait. After decades of service, a chapter came to a close. Dr. Talat passed away at 71 after a life of exceptional professional excellence and humanitarian service. He left a legacy that transformed the understanding and practice of mental health across the region. Remembered as a visionary reformer, a pioneering educator, and a compassionate healer. Yet the system he built continued to serve and evolve. Dr. Talat transformed Kuwait's mental health care from confinement to compassion, laying the foundation of a modern psychiatric system. Today, the Kuwait Center for Mental Health stands as his living legacy and institutional successor built on his vision. KCMH is Kuwait's leading psychiatric hospital and a prestigious training center for Kuwait University's Department of Psychiatry, providing practical training for MBBSKU students, psychology and nursing students, and hospital staff. Thus, his legacy thrives in every patient served and every clinician trained. Dr. Mohamed Talaat Reda, founder, visionary, humanitarian, and a model of perseverance, laid the foundations of mental health care in Kuwait. Guided by science, dignity, compassion, and unwavering resolve, he challenged stigma, transformed public perception of mental illness, and changed countless lives. His legacy endures to this day because he did not conceive of his role as a mere salaried position, nor did he confine himself to the formally prescribed responsibilities of overseeing the asylum. At no point can his work and achievements be reduced, under any circumstances, to mere compensation. Rather, his contributions are best understood in terms of their enduring institutional and intellectual impact, as reflected in the foundations he established and their lasting influence on the development of the nation's psychiatric history.